Connor. It's Jennifer again.
Hi, Jennifer.
So you guys are getting ready to go. Are you excited to get out of here?
You excited to go home?
Yeah. Oh, so cute. All right. Well, just wanted to go over a few things now that he has his new Mickey button.
Okay.
How's it working out?
It's good. It's good. We, just a little nervous about what to do with it when we get home. I have some questions.
Well, and that's what we're here to do. Can we take a quick look at it, Caleb? Can you show us?
Can you show her
your
your
little
button? Can we show her your purple button? Okay.
Oh, look at that.
Wow.
See, it looks really good. The site looks really nice.
Yeah.
That's the way you want it to look, that nice pink
Okay.
site. That's really good.
Okay, great.
Looks good, Caleb. You've got 2 buttons now.
Yeah. And that's your belly button, and this is your Mickey button.
Perfect. Okay, so I have some information here. This is going to be a quick little reference that you can keep handy.
Oh, great. Okay.
We've written some information down here. This tells you what kind of feeding tube you have.
Okay, so we have this G one?
Yes.
Okay.
And it's called the Mickey button.
Okay.
His is a 16 French 15 stem length.
Okay.
2 centimeter tube length inside.
Okay, so that's what's inside.
Yes.
Okay.
And this information, you don't need to memorize it. This is just if something were to happen, the doctor would want to know, or the emergency room would want to know what size and style that you had, so they could replace it.
Okay, great.
I have his medication listed. He's going to be going home on Pepsid now.
Oh, okay.
Because of the tube feeding.
And how often am I giving him that?
We're going to do that twice a day.
Okay. Okay. And this 20 milligrams.
20 milligrams liquid right around the time he eats.
Okay.
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 In the morning and at night. Dr. Gastro's your doctor.
Okay.
There is the contact information.
Okay. And that's who I call if I have any trouble with this?
That's right.
Okay.
That's right. That's who you're going to follow up with. Now, we want you every day to take a look, just like we just did. We want you to look at the site. We want you to clean it with some gauze and water, just to make sure it's not crusty.
Oh, okay.
And
just water?
No just soap water. No soap. You don't have to use soap. And just look for those signs of infection that we talked about earlier: the redness, oozing, swelling. Yes.
Okay.
Those kinds of things.
Otherwise, it should always look like
it should always look just like that.
Okay. Great.
That looks perfect.
Okay.
That looks perfect. And no baths until he follows up with Dr. Gastro.
Okay, so how do I just wash him then from the bottom down?
Okay. Yes. No submersion in a bath. Just until you follow up with Dr. Gastro, and that has a little more time to heal.
Okay.
Now, if something were to happen, because I know Caleb's excited to get out of here so he can run and play.
Yeah. So what would I do if can it come out?
It can.
Okay.
It can. It shouldn't. It's in there pretty secure.
Okay.
But it happens.
Okay.
So if it comes out, because this is a fresh G tube, it's brand new to him, we would want you to try to reinsert the tube or the Foley catheter, the tubing that's in it. If you can't get it all the way in, at least try to keep that opening there, because being so new, it can close off really quickly.
Almost like a piercing in your ear.
Exactly like that. So as soon as you notice it, try to put the button back in and go immediately to the emergency room. Okay? Because they're going to want to make sure that everything is placed correctly and that everything looks good.
Okay.
Now,
so even if I can get it back in,
even if you can get it back in, go to the emergency room. Okay. Now, after a few months, those instructions may change a little bit.
Okay.
But for now, if something comes out, try to put it back. Any portion of it, try to put it back and take him straight away to the emergency room.
Honey, we're gonna try not to play with that because we don't want
I know, it's so fun.
Oh,
You're going to be like a special show and tell when you get back to school.
Like a little superhero with your special button.
Now this is the food that he's taking right now, this Jevity,
Okay.
and he's had 12 ounces at a feeding here at the hospital. Now, don't be worried if he can't get all 12 ounces in, or let's just when you get home, just make sure that you have the Jevity and that we try to get an entire feeding in at one time.
Okay, and I will be getting this through who? The home health?
Grand Canyon Home Health should be contacting you as soon as you get home.
Okay.
He's going to be gravity fed. That's that you know, remember this,
Oh yeah, yeah.
the syringe that we use?
Okay.
He's going to be
So I
gravity
fill that
fed.
to 12 ounces.
No.
Okay.
We'll get there in just a
Okay.
second, but you'll have a syringe like that that'll help you with the feeding.
Okay.
And in fact, that's the equipment that we're going to go home. We're going to get you a few of these syringes.
Oh, okay.
Some of the extension tubing, like that you have there, and the Foley catheter tubing. We're going to send you home with that so that if, depending on what time Grand Canyon Home Health contacts you and gets out to your house tonight,
Okay.
we want to make sure you have supplies ready.
Great, thank you. And that's their number.
And this is Grand Canyon Home Health Nursing's number. And they're going to keep you full of supplies. They're going to keep you stocked up with that. And then you know that you're going to call Dr. Gastro about that with a follow-up appointment. He's going to want to see you in 2 weeks.
2 weeks, okay.
Okay?
So make an appointment for 2 weeks from now
2
for
weeks.
him to check it.
Yes, and at that number that we discussed. This is a lot of information, Caleb. And then the rest of this, the discharge instructions, you've been hearing us use terms here that you might not be familiar with, so I thought it might be good to know what a flush is and the bag and the bolus feeding. So we've attached this information sheet for you.
Okay.
Stoma, you've heard us referring to his side as
That's
a stoma.
The stoma is the opening.
Yes.
Then? Okay.
Yes. See, you're going to be a pro at this.
I hope
you are
so.
going to be a pro at this.
It's a lot of information.
It is a lot of
but
information.
I appreciate you taking the time.
But we're going to give this reference to you and, you know, take the time to answer your questions. If you need to make an emergency, we would suggest that you keep an emergency kit with you.
Okay.
When you go to the park, always have, you know, these supplies, keep them with you, keep them with him, maybe in a little backpack that he carries with him.
Maybe have a couple, one at school. Would that make sense?
Yeah,
Okay.
that would make a lot of sense. And in there, you want to keep the Foley catheter and an extra G tube. You want to have the water-based lubricant, the syringes, extension sets, tape, water.
Okay.
You just want to have those things just in case.
Okay.
Just in case, you always want to have them on hand. And again, this tells you how to follow up with your doctor and when you need to follow up.
Okay.
It's a lot of information.
It is,
Connor.
but you know, I appreciate you taking the time to explain it all to me.
And we have this. Look at this, Caleb. Look at these
Look at
pictures.
all these
Other
kids.
kids that have G tubes just like you. And this pamphlet was created specifically for pediatric patients that have it, and it tells you exactly how you're going to feed him. What do you do with the tube?
That's great.
And
Okay.
all of the supplies you may need.
Oh,
to
those
have
are
on hand.
those are like the emergency kit supplies.
And one of the best parts of this is on the back, there's a couple of websites, some really good websites where you can find support groups, other children, maybe meet up with other families that have
wow.
the
Yeah.
same kinds of concerns and issues, find out what's worked for them and share what's working for you.
Okay.
So I'm going to leave all of this with you. What questions do you have? What can we...
I mean, I just wanted to know what to do if it came out, and I feel like you answered all of my questions, and I feel like most of them are on here in case I forget. So I really.
Well, do you want to show me real quick then? Let's just.
Yeah, that'd be great.
Caleb, can mommy show Nurse Jennifer about how she would attach this if she needed to flush? Just to make sure we understand how all of these connections
Okay,
work.
so which one?
That looks like the same like mine.
I know, and you're gonna go home with a bunch.
We're gonna take these home with us. So, is there one that I give through here?
Yes.
Okay, and so I would have the liquid in here,
Mm-hmm.
and then I would attach it here,
Yes.
and then I would push slowly,
Yes.
or yeah, is that just
That's perfect.
Okay,
And how does that feel, Caleb?
how's that feel in there?
Doesn't hurt or anything, does it?
No ouchies?
See, Mommy's gonna do a great
And then
job.
I close this then when I'm done.
That's right.
Okay, great.
All
Well,
right.
thank you, Jennifer.
Well, thank you.
Okay.
Thank you for letting me take care
Say
of you.
thank you for taking care of me.
Thank you.
He's so cute. All right, well, good luck to you.
Can I take them off?
No, we're gonna leave those on.
All right.
Okay.
Let me know when your ride gets here and we'll
Okay,
wheel them
great.
out.
Thank
okay.
you.
Bye-bye.
Bye-bye.